Good morning, everybody. Welcome to the Southside Healthy Community Organization non-emergency medical transportation question and answer session for our proposal that was released about 10 days ago. We're excited to be in process here. There were a number of folks who submitted a letter of intent, and we're excited to share some responses today for questions you might have or we've received to this point. My name is Leif Elsmo. I'm part of the co-chair of this work group around social determinants of health. Want to share with you the roadmap, Google Maps here for today, for those of you that are following along. We have some opening remarks here with an overview from Kimberly Hobson, our Chief Executive Officer for the Southside Healthy Community Organization, and Jackie Rouse, my partner, co-lead of this work group from Advocate Aurora Health, was with me. I'm here from U Chicago Medicine. A couple of the partners here in the Southside Healthy Community Organization will be going through some of the components of the RFP and trying to respond to some questions that have come in or you may have for us today. It's great to see the room gathering, and we're excited to start. With that, we probably will take up much of the hour, but if there's not questions toward the end, we'll give folks a few minutes back, but let's determine that as we go along. I'd like to hand the steering wheel here to our CEO, Kimberly Hobson, to give us an overview. Thanks, Kimberly.
Thank you, Leif. Good morning, everyone, and thank you so much for taking time to join us this morning. As Leif mentioned, I am Kimberly Hobson, the CEO of the Southside Healthy Community Organization. I just want to tell you who we are and just a bit about what we do. And so the Southside Healthy Community Organization, which we fondly call SSHCO, we have been standing up this 501c3 for a year now, for just over a year now. So we're very excited about the work that we're doing. The SSHCO is actually comprised of 13 healthcare organizations on the south side of Chicago. We've got safety net hospitals, we have health systems, and then we have federally qualified health centers on the south side of Chicago. 15 zip codes are the zip codes that comprise the south side of Chicago. You will see that we stretch the entire south side. You'll see all the zip codes to your left, and then just to the right of that, you will see where all of our organizations are. The pluses are our federally qualified health centers, and then you've got our hospitals in a blue color, and then darker, you've got our health systems, Advocate, and University of Chicago. Next slide. So I mentioned that we were comprised of 13 organizations on the south side of Chicago, and our ultimate goal is to improve health and transform health for residents on the south side of Chicago. And so we aim to do that by adding primary care and maternal child health care providers, getting those hired and deploying those into the community to increase access. We also are developing a behavioral health platform that is going to increase access to behavioral health. And then a really, really interesting part of what we'll be doing is tying this all together by creating a connected care technology platform where all 13, over time, all 13 of our healthcare providers will be able to share technology across all of the organizations for the patients that we have in our programs. And so we will be partnering with a variety of organizations to increase access to community resources. So you'll notice that in many instances, you'll hear me say we want to transform and improve health, because transforming health is not just all about health care. It's health care, and then it's the social determinants of health, like transportation. And so we will also be deploying care teams into the community to help us do all of this work. And so as we've done our work over the many, many years, we do understand that transportation to medical appointments is really, really a barrier for many of our patients. And so what we really want to do is develop a partnership to address these transportation barriers, because we know that when there's a lack of transportation, patients don't make it to their appointments. You've got delayed care. They don't have their medication. And so therefore, it does not help us to improve our health outcomes. It actually decreases our health outcomes. And so what we're really doing here is we're seeking an experienced and qualified non-emergency medical transportation company to transport our patients across our Southside Healthy Community Organization partners. And so we want to make sure our patients get there, they get there safely, and then we can have them picked up and we can get them home as well. And so although it's not a requirement, it's not a full requirement, there is precedence given to for us to collaborate with state certified minority and women-owned businesses that are located on the south side of Chicago with this request for proposals. And so what I will do is I'll just end by thanking you so very much for being interested in the work that we're doing and partnering with us as we strive to improve and transform healthcare on the south side of Chicago. And so now I'll turn it over to Jackie Rouse.
Thank you. Good morning, everyone. So I'm going to go over the timeline. As you're aware, we did release this RFP on November the 2nd, and the letter of intent was due November the 10th. And thank you for submitting those letters of intent. And then, of course, today we're having our virtual RFP question and answer session, and appreciate everyone being able to make it today. As you are aware, November 22nd is when the applications are due. And so that is next week on the 22nd. And then November through December is when we will be conducting our RFP review. So we'll be reviewing those applications throughout that time. And then we will make final decisions in December. That's when we'll announce who the awardees are. So just make sure that that application is submitted by Tuesday, November 22nd at 5 p.m. So that is a firm deadline. Your application should be uploaded and attached in an email to info@southsidehealthycommunity.org. Thank you.
Thanks, Jackie. Before I cover this, which is going to be what I think is a key data point and slide for the balance of our conversation and question and answer today, let me state two things. One is that we're in an incredibly speedy process here for these RFPs. So you can feel that it's important that we get this done on this timeline. The second piece is that for today in our Q&A, we're taking question and answers through the Q&A function inside of Zoom. So if you look at the bottom of your Zoom bar, most of you are used to this at this point, there's a Q&A button that you can see. If you open that, you can submit your questions there, and we'll stack up a queue here of questions and be able to take them down one by one. I see somebody already has put in a question into the Q&A there, but for everyone else, that's how we're taking questions today, so we can make sure that we answer them all. Next slide, please, Twing. Thank you. So here's where we've landed. We included some of this into the RFP, as you see. So the RFP describes what we're thinking. This is a new developing healthcare transformation project on the south side of Chicago. We have started and are moving forward and through this process, and we're building some of our work around some economic assumptions here, right? Based off of what we've learned to this point and what we know from our health systems, the FQHCs, all the things that Kimberly listed in some of the opening slides. So we're asking for a partner here to think about how we go forward with transportation. So we are new. We're in a sort of startup phase of taking in patients here and moving patients. So we're looking for a partner to figure this out over time. So the RFP describes a little bit here about what we're thinking. The SSHCO, we need to move patients, as we've said, and it's changing quickly, right? We don't really know exactly how this is going to look year 1, year 2. So we're looking to engage with the partner here through this proposal process. We're estimating that in the first year, that we'll need 38,000 rides. Okay, and I mean that how we're saying that. One-way rides, right? So may take a patient there, take a patient back, home, whatever that is, or from site to site. We think we're going to need 38,000 one-way rides in this first year. That may grow over time. It may be less. We may work together to project that into year 2. But right now we are looking at 1 year, and we're looking at that volume of rides, but we don't definitively know. We've just started enrolling patients, and this is our best math at this time. So it's an estimate. It can range during implementation here, and we want to just put that out there, that that's the math we're working on here and we're looking for in each of your proposals. So with that, we'll probably come back to that number multiple times here in the Q&A. Kimberly, Jackie, and I will be working on responding to your questions both through the Q&A function in Zoom or those that have actually already come in by email. So we have a couple of those, but I do see, Jackie, that there's one already that has come forward. So let me pause there and we'll move into the Q&A section. Thank you.
So the first question we have so far is, will you accept letters of support? And yes, letters of support are welcome, especially if that letter is part of how you're going to provide services. That would be acceptable.
Hello, this is Jatan. I'm going to represent the questions that were answered by web. So I can just read those out.
That came in through email.
Yes.
Is that right? Okay, great. We'll
Yes.
tackle those, and maybe a few more come up here through the Q&A function. That's great.
Absolutely. And please feel free to, as I'm speaking, please feel free to put your questions within the Q&A function. So the first question we got online, do you have a preferred budgeted range?
Oh, Kimberly, I guess you and I'll do this dance. We're really looking for our proposed partners here to respond based off of the math that we shared in the last slide, that 38,000 one-way rides. We're thinking about this for the long run here. So we're looking for applicants' proposals here to give us some sense. We're not transportation experts. This is a process that we're going through with you through this proposal process, and we'd love to hear what people's thoughts are around that. You know, we have some thoughts in our minds, but we're really looking to collaborate on that answer. So we'd like your best estimates and math and budgets based off of that economic assumption of 38,000 rides at this time. So we're looking for each of you who are considering applying here today to give us some input on that question itself. 38,000 is our year 1. This is a 1 year we're looking at, and we'd love to hear from each of you on that. I do see another question came in, but let's move through the ones that came in by email first, Jatan.
Sure. The next one is, I am not state certified, a state certified or minority woman-owned business, but I operate on the south side of Chicago. Should I still apply? Kimberly, you're on mute.
Yeah, can't hear you, Kimberly. Sorry.
I would say yes to that. We just, as I mentioned earlier, although it is not a requirement, there is preference given to minority and women-owned firms that are on the south side of Chicago, but that is not a requirement. And I would suggest that you submit your application. So not a requirement.
Yeah, I agree, Kimberly. And Kimberly, this might be good to respond to around why is that? I mean, we set some goals, right? For the SSHCO, it might be worth sharing that, why we're even asking that, question.
Yeah, so thank you so much for that, Leif. I do think it's important that we mention that. So the Southside Healthy Community Organization is a part of the state's effort to transform healthcare on the South Side of Chicago. And so part of our proposal, but more than that, part of the agreement with the state funded this organization for a 5-year period. And part of our agreement with the state is that we have a certain percentage of our staff and vendors and any partners that we in organizations that we partner with be of minority and women-owned firms on the South Side of Chicago. And so though that is the reason that we really need to make sure that we are conscious of this. So that number is not 90%. There is a requirement that we have a certain percentage, though, of our partners to be women and minority-owned firms. And the goal of that with the state is to build the South Side of Chicago and support business and ultimately transform health on the South Side of Chicago.
Yeah, thanks for adding that context, Kimberly. I appreciate it. Jackie, this next question may come towards you. Jatan, what's next? I see a couple are queuing up in the Q&A. That's great, but what's next in the?
Yeah, very related. We can answer. We can ask this one, and then you can totally, because same topic. But my transportation company subcontracts with state certified minority women-owned businesses. Does this count?
And the answer is yes, that does count. You can apply for the funding.
Yeah, we'll look at now. Granted, we're going to vet this. I knew Jackie and we had talked about this. Tier 1 and Tier 2 spend counts, but we're going to need some clarity and definition around that, and we will be looking at that certification. So appreciate that question.
There's a similar question too in the Q&A. Is there a MBE or WBE preference in scoring? Do you also give local preference points? And in the RFP, we do not have preference scoring for being an MBE. We are encouraging organizations that are of this capacity to apply, but it's not part of the scoring, and we don't give preference points for local either. But what we do have is to make sure that you as an organization is serving the community in those zip codes that we have indicated.
Very important. And I will back up too. I mean, local economy is a part of this whole thing, of course. So while there's not a preference score, if you will, we are paying attention, of course, to the geography of serving the population we're talking about here. And local economy is always good for all of our institutions inside the Southside Healthy Community Organization. We look at local spend where possible. So worth noting, a good question. Jatan, there may be other questions in the queue, but I'm tracking the Q&A here too with you, Jackie and Kimberly. I think it looks like there's a question around how many awards are expected to be granted here. There's also another question. I may have jumped ahead one, so just let me ask my colleagues here to make sure we're capturing all of them. How many awards are expected to be granted? I think what I talked about before was a partnership, right, Kimberly? Where
yes.
We are really looking for one partner here that can work with us in this important inaugural year here where we're moving patients. So we're going to award one contract here, and with that, certainly an opportunity for growth. Now, there may be subcontracts. You may subcontract with other businesses. That's fine, but we're looking to reach an agreement with one, and how the business is conducted. You can outline that in your proposals for sure. We're excited to see that. We're excited to learn and grow with whatever the original contract is here, but we are awarding one. And we are looking for a partner that can handle this kind of volume here locally, certainly within the zip codes that Jackie outlined there, and that are outlined in the RFP. Kimberly, I don't know if you want to add more there. I mean, we started enrolling patients here very recently, and it's moving quickly, but I don't know if there's any more color you want to add to that picture.
No, I think you covered it. We are very excited about this. We have started to enroll patients into our programs, and we've mentioned on our town hall that soon, into 2023, there will be an opportunity for transportation support for patients. So just continue to be a very important piece of the work that we're doing.
The next question is, there are some very large MEMT firms on the south side of Chicago. Are you open to also considering smaller firms who can perform the anticipated patient ride volumes? We have learned that some smaller firms can lead more personalized attention. Great point. And yes, we are hoping that even the smaller firms will apply. And also just really want to reiterate that it's important that the volumes that we are anticipating are met. And so definitely willing to review any applications that are coming from smaller firms. Yes.
Kimberly, I think may hand this one to you around what we're thinking around coverage of the cost. I mean, I think some of this is going to come through proposals, but I'll yield to you on this one.
Is this the one that just came in? Will the rides be 100%?
Yeah, I'll play it out. It's will the rides be 100% covered by Southside Healthy Community Organization? So this fund, if you will, or will there be co-pays? I guess PACE, has some of that. Some other non-emergency ride, companies have that structure. I'm just curious, or I think they're curious.
Yeah.
Preliminarily, at least. Yeah.
Yeah, I would say preliminarily, we are not looking for there to be co-pays. We are still working on our model, and it's going to matter how we are able to select the organization. And as we negotiate the agreement, I would say currently there is no intent for there to be co-pays by the patients that we serve.
Yeah, I think especially in this first year, right?
Yeah. I think we should be mindful that, like you said, this is something new that we're doing. I would say that it's an iterative process. And as we move year over year, we will reevaluate this. Initially, we are not looking to have co-pays, but it will, will determine over time if this will evolve into what it's really going to be.
There was a comment in there.
Wow, I saw that.
Yeah, I wanted to share that out because it moved off the Q&A. But
right.
I think there's a learning curve a bit on this too, right? I mean, we know you all as transportation companies have been doing this for some time. We're trying to figure out what is going to make get the sort of maximal benefit or impact here from this. So for year one, that's how we're looking at it. And I'm sure we will all learn a ton from this, but we think right now stripping away that barrier of transportation will help us move patients through, people through, our neighbors through, into better health pathways. So this is new at some level. We're doing it a little differently, right? And so that's the process here.
Yeah.
I saw we're going to wait a second here. A couple people joined a little bit into the mix. For those that joined after I may have said this, at the bottom of your Zoom bar, there is a Q&A button. That's how you'll submit questions in case, and it's fine if there's a repeat question, we'll answer it again. No problem. Jackie will answer it again. We're just going to give them all to Jackie. So feel free to submit. Don't worry if it's been asked before. We'll cover it again. We want to make sure that people are able to get their questions in here while we have this dedicated hour to do that. And if we don't have something here, we'll put something out on the website, but I think we've received a couple. Jatan, did we cover all of the previously submitted questions? I don't have that up in front of me.
Yes, we did.
We did. So there were some questions submitted online prior to this, so we covered those. We have cleared the queue at this point on the Q&A function inside of Zoom, but want to give it a beat here, so we make sure we're responding to any. So we'll hang out for 1 second here.
Leif, I have a question if you don't mind.
Yes, Twing.
Are participants allowed to include overhead costs or any fees to the proposed budget?
Yeah, this is a great question, Twing. I mean, we expect there will be some overhead costs in the proposals. We'd like that to be itemized as possible. However, I don't think we're really looking for that flat rate overhead or indirect costs. We'd really like people to, in the budget process, to itemize as much as possible what some of the expenses that come in are. Now, all of you probably have different budgeting processes and financial models that you use. I mean, we're very open to seeing those, but I would push against just putting in a flat rate percentage if you can. Try and break that out. We really are interested here in seeing what the actual costs are for this. So please itemize as if possible. Anything you want to add there, Kimberly? Or
I think that's I think that's critically important that we get as much itemization. We do not want one administrative cost and then throw a large number in there. It's going to be critically important that we can explain what we're paying for.
For so many stakeholders on this, right?
Absolutely.
Surely the SSHCO is a new entity, but look, we're working with the state, we're working with donors and philanthropy. There's a lot of things going on here, and that's important. So thank you for adding that definition to it, Kimberly.
I just wanted to note for all the viewers, and just in case someone wasn't able to attend, this webinar will be recorded and it will be posted on the SSHCO website. Just wanted to call that out. So if anyone's attending here and you know of a transportation company who completed their LOI, they are able to view this webinar. It will be posted online.
Or if you all want to rewatch our dazzling presentation today, you can go do that as well. When will that be? When will that be posted, Jatan? Tomorrow?
Eric? I have to throw it to Eric.
Yeah, we'll try to get it up by tomorrow, end of business tomorrow. So if you need to look back, that's great. Jackie, it might be worth, since we cleared the queue, maybe looking, or if Twing, you don't mind taking us back to the timeline one more time, just to remind folks where we're at.
Certainly.
And we got another question, just pointed out real quick.
Great. Kimberly, this is a tricky one. It's really a projection around. We can keep this slide up for a second here, Twing, that's fine. The question is, what are the days and hours of service you are looking for? Are we looking for 24/7 coverage here?
You know what, I'm just gonna be transparent here. We do not know that right now. We just haven't determined, and Leif and Jackie in the social determinants of health work group, let me know if you've talked about this yet. I think, of course, the bulk of our need is going to be during the day, because that's usually when individuals are going. We've looked at this, I remember not recently, but the majority of care is delivered, in terms of getting to appointments and so forth during the day, between 8:30 in the morning and 8:30 at night. But I can see, now that I see this question, that there may be some emergency need overnight. And so I do believe this helps us as we continue to evaluate that. And perhaps as you submit your proposals, you may want to put, if there is emergency, if there's room, or access to emergency rides as well?
Yeah, this is a great question.
Yeah, it is.
My gut is like yours, Kimberly, here too, as we're building this.
Yeah,
The RFP is listed as a non-emergency transportation RFP. I think that's
right.
accurate. I think that's accurate. We're looking at, connecting people to medical
Mhm.
homes and those kinds of things, ensuring fidelity to, health improvement plans, connecting to appointments, those kinds of things. So I really think it's probably more during healthcare business
Hours.
hours.
Yeah,
I think if we have an emergent situation, we'd yield to emergency medical transportation on
yeah.
that. But I'm with you, Kimberly. If there's something that maybe we overlooked and you need to put it in your proposal, I really do think, though, this is about moving patients to appointments and those kinds of things. So I'd stay within that model here.
Range.
Yeah, that would be my gut. Another question came in. Jackie, do you see it?
Yes, hello. Is there a certain amount of wheelchair and ambulatory vehicles that you are requesting? I have to pitch that to my team members to
Yeah, I
answer.
think that's kind of all of us here.
Yeah,
We
I
need
think.
that capability,
Yeah, I
right?
was gonna say we definitely need the capability because individuals in wheelchairs need to get to the doctor as well. So I would definitely say that you should include that. But of course, we don't have a specific number. I think we would be looking to you as as developing a proposal. If we're looking at the number of visits, do you usually see a certain percentage of those that will need wheelchairs or what have you? But I would definitely factor that into the proposal.
Absolutely, accessibility has to be a part of a respondent.
Mhm.
It's it's difficult to respond to what your fleet is. Neither Kimberly, Jackie, nor I have any idea what your fleet is, but the
Right.
ability to be able to move people who may have some needs there around transport, special needs around transport, we absolutely need that capacity built in, no question. Yep.
Mhm.
One more in here. A couple more are coming in now. I'll take the first one, Jackie. Maybe you take the second one. The first one is, do you service the life-sustaining population that will require standing appointments, dialysis, chemo? What about methadone patients? Kimberly, we're gonna have to do this one together. We are growing into this, right?
Yes.
So
Mhm.
I think part of where we started here is both preventative care and health improvement, right? I mean, connecting to medical homes,
Mhm.
certainly treating chronic disease. I think we're getting into some specialty categories here. I don't know, Kimberly, how the SSHCO has approached this.
Yeah, right. Yeah, right now, of course, as you mentioned, Leif, we will be expanding over time. But right now, our patient population is the Medicaid population that are in our program. It's the Medicaid population. Of course, we're looking at some chronic illnesses like, some maternal child health issues, behavioral health issues, and so forth and so on. So we have not gotten to very, very specialized dialysis and chemo and all of that. But I can imagine that, over time, we may begin to look at that. But right now, we're looking at the Medicaid population with the basic chronic conditions like hypertension and, maternal child health, behavioral health, and so forth. I
Yeah.
don't know that we would be turning individuals down if they meet that criteria and then they have some of these other issues. I don't know that we'll be turning those individuals away, but there is priority given to our patient population at this time. I can imagine that it may grow and change over time.
Yeah, I mean, there's specialty stuff
Yeah.
into the future, right?
Sure, absolutely.
And
we will continue
we are
to grow the
looking.
specialty care areas.
Yeah, but that's a year two,
Down the
year
road.
three. Yeah, we're really looking into this. I mean, that's a great question, by the
It
way, and
is.
one we're going to take back. I just don't
Mhm.
think in this year, this contract, that's where we're focusing.
Yeah,
We will learn something though, and that's why we're really looking for a partner that can collaborate with us effectively to figure that out into the future. Jackie, I think
agreed.
you're up
Okay,
next.
the next question is the 38,000 approximately one-way trips are for a 12-month period. And yes, that is for a 1-year period.
You see in the next one, Kimberly.
Yeah, I'm looking at it. Mhm. So it says, so the volume that you have, 38,000, is straight Medicaid and not attached to a MCO that already provides transportation through their insurance. So it is Medicaid, I should say Medicaid patients that are attached to or assigned to one of the approved Medicaid MCO providers. So we are working closely with the managed care organizations. I do know that some of the managed care organizations have transportation as well. I know I've talked to Blue Cross, and this is one of their priorities as well. And so we are looking at Medicaid patients that are assigned to managed care organizations, and we are looking to partner and work with managed care organizations, those managed care organizations, because we don't want two organizations to be scheduling rides.
Will we move any uninsured patients at all? Kimberly, do you know?
You know what, right now, our, I would say yes, we will consider that. Right now, though, we're looking at Medicaid patients, but some uninsured could be a part of that.
I think that's part of the coverage.
Uninsured, yeah.
We're,
Yeah.
again, I can't state it enough. We're growing into a new model here, and that's going to require some flexibility, some adaptability, and some collaboration, to be honest with you. I mean, we're looking for your best estimates and best approaches here. We're learning with you too. I think we know we're going to need, we know this is a barrier. We know transportation is a barrier to healthcare and health delivery. That is for sure. And it is come up through listening sessions with the community, stakeholder meetings, data and focus groups and all kinds of things, right? So we know this, and that's why we're pushing forward with this RFP in this first year here. And we're excited to see what you all come back with. One more question in there, I think, Jackie.
Yeah, it's actually a comment. It's awesome sauce. I'm glad that you touched on rides not being scheduled twice, because if they are attached to an MCO, a lot of the rides go through 2 different companies. So
I'll take awesome sauce. That means we're on to something here, and look forward to learning more about it.
I had one question again for Leif and Kimberly and Jackie. As we know, caregivers are quite critical to patients, making sure they get to their appointments, as well as discussing with their care providers whether or not they have medication use and how to support them in that usage. Are caregivers able to join these patients on the patient rides?
Wow, good question. Thanks, Twing.
I would definitely think there needs to be consideration for that. Just like there are, there are guidelines since COVID. You come in, but only one person can go with you into, to the appointment or what have you. I would certainly think that we would build in that there might need to be a, some type of stipulation that someone could ride with you. But that is something really critical to think about, because sometimes you have individuals with their children and so forth. So that should be a major consideration for us.
I think we listed one thing into the RFP too, or Shirley had this discussion, we talked about accessibility, car seats. that kind of
Right.
thing might need to be needed here. I would say, this is something, I don't mean this as a boomerang here, but it is a little bit, right? What's the model for your company? I mean, is it an additional dollar charge for that caregiver to come in? They're going to the same place, right? How does that work? What is the
Yeah.
math on that? How do you set it up? I mean, if I go on a ride share with Kimberly and we go together, there may be an additional fee, but you're not charging us twice for it, right? So what does that look like? That's multiple people in a car. I'd be curious what the models are in your proposals, and what the capabilities of your groups are in transporting a family, for example. I mean, that may come up here that that could be the case. Mothers going to an appointment, caregivers going to an appointment, and bringing a young one along with them. What does that look like? We're trying to think all the permutations here. Obviously, one proposal will not solve for all that. So put your best foot forward. We're thinking of all the dimensions of this. I see another question came in the queue.
Yeah, I see this question too. It says, will all patients be exclusively in those zip codes? Will there be any patients outside of those areas like the south suburbs, or who are participating in the SSHCO, who we would have to transport? What I can say now, and Jackie and Leif, you may need to jump in here, is that our initial focus is within the 15 zip codes that we have listed that make up the Southside Healthy Community Organization. And so our goal is to stay, as closely as possible within those zip codes. That would be my response to that. Leif and Jackie, do you have anything to add to that? Yeah.
No, this is our neighborhood. This is our community. This is who we're serving. That's where we're focusing our efforts.
And I mean, our the south side of Chicago proper goes all the way out to like 130th Street. So, I mean, we're not talking just 87th or 95th. We have a health center on 130th, right off the expressway, and that's as far south as we are looking to go.
Next question. Are rides exclusive, meaning no shared rides with other patients, or are multiple patients allowed to ride together? Yeah, I would assume multiple patients would be allowed to ride together.
Yeah, I think that's your model, right? I mean, I wasn't.
Yeah, I would think so.
I wasn't thinking of carpooling or ride sharing or whatever. I mean, whatever you think, but maybe that's the case. That could be a great model. We're open to that. One more in the queue, I see. We're toggling on and off that last slide, Jackie. We're gonna get to that timeline. I'm telling you. A reminder. Now, next question was, will you closely with the transportation provider selected when it comes to scheduling the patients to come to a clinic? An example, will you work closely? Yes. A couple of patients have appointments around the same time. So the smart thing to do would be to pick up as many patients as possible, ride share. Yeah, I think that's building the model, right? It's hard for us to say what household, what zip code that patient is going to need to go to this medical center today. That's why we're kind of looking for you to build your responses, your proposals around that volume. But you can imagine it across those zip codes, right? We don't know exactly today where those patients are gonna be and going to which medical site. So I do think there's a nimbleness, flexibility, adaptability in the model we're looking for here to work with us on this. So the critical elements of that, Crystal, is, will you work closely? The answer is yes. We have to figure this out together, and we're looking for the right partner in that.
So the next question is, as part of our proposal is technology a factor, or will this be provided by SSHCO, i.e. tracking of rides, dispatching, et cetera, not provided by SSHCO. We're looking for this to be a comprehensive a proposal that definitely factors in tracking of rides, dispatching, and reporting as well.
That accounting, right, Kimberly,
Yes.
absolutely, yeah.
Let's see, next question. Are we allowed to break down the pricing that is needed for things such as car seats, off hours, times, dead miles in our proposal?
If that's part, if
That's
you,
part of
if
the
that's the way
operations.
you, right, if that's part of your operation that you build in pricing for car seats and that, quite honestly, I don't know what your model is, but I do think if that's part of your model that you would break out, you know, car seats, off hours, times, and all of that, I would say include it. I don't know what dead miles are. I wonder.
I guess
Anybody know
that's if,
that?
I guess that's if a driver's waiting,
Okay.
right?
Waiting or?
You know, I mean, I think here,
Mhm.
this is I don't know if this is the right response to that, but that's my assumption here, that we're expecting that ride from that space to that space. Dead
Mhm.
miles here, you know, you pick up another ride. I'm not trying to be flip about it, right? We're not looking for the driver to wait necessarily. Then they may go back in the queue. I think that's the kind of model we're looking for, is that ride to from. If dead miles if that's what that means, then I guess you can build it in. My assumption is that you'd pick up another ride.
There's the answer in the chat for what dead miles are. I just wanted to point that out before I move
Okay.
it over.
Well, the way I read that is you're taking the patient to the space. So I don't know what that means. Dead miles there. Sorry. If the miles it takes you to get to the
Get to the
destination
destination.
before you pick up the patient, if that's what that means, then
Ah,
I would say, yeah, right. I mean, I guess.
Yeah, and just I'll make sure you're including things that will help us understand your proposal and what value of the service that we're getting from your proposed program.
I mean, I'm reading into it a little bit, and I'm only using from my experience here. I think we would be paying for, or you would be charging to move the patient from A to B. If you were to pick me up for a ride at my house and take me to a meeting, right? You wouldn't charge me for the time before you picked me up. So I would say probably not including that. If that's what dead miles is, I would look to factor the math based on taking the patient from A to B.
yeah.
And that
like
would
that.
be, I would include that in your proposal and not dead miles, if I understand that concept correctly, but I'm not a transportation expert. So give me some grace in that one. But yeah, getting to the patient's home or to the medical center, I
Yeah.
don't think that should be factored in. Last question, I'm doing a process check. Maybe there's one more. We have 10 minutes left. Just want to do that process check that we are moving to close. So if you have a question, throw it forward. Now's the time. We're excited to try and answer the best of our abilities.
So I'm looking at this next question. This is not a question that I can answer. I'm not quite sure, you know, NEMT and API. I don't know what those acronyms are. And so I don't know, Jackie and Leif, if you're familiar with those
Well,
things.
NEMT is non-emergency medical transportation. I know that. So will rides be sent to them? So for example, an FQHC says we need somebody to get from A to B. I assume that's how it'll work. But I don't know what API is. That may be a rideshare technology. I'm not sure. Can someone add some clarity to that? And if we don't have that here, we'll look it up and you know, put it in maybe on the website in an FAQ format.
I'm wondering, could this be how will they, okay. Yep, how you receive rides. They answer, it's in the chat right now. It's in the Q&A. They clarified.
again, I think SSHCO is going to be determining who needs a ride, right?
Yeah.
And
And the referral for a ride or what have you will be, will be put into whatever system we're using for that, because our staff will be in the sites. They will be at St. Bernard. They will be at Friend Health. They will be at all of our various organizations. Our staff will be determining that, whether it's a physician, a nurse practitioner, or community health worker, or nurse care coordinator. And we will be looking for them to put the information into whatever the system is to request that ride.
that's a great clarification, Kimberly.
Mhm.
We want to be able to, vis-a-vis your system,
Yes.
request a ride. So
Mhm.
the respondents,
Right.
these proposals will need to have a system that we can make requests to. We are not, we are not a transportation company, right? So
Right.
we are looking for a partner to be able to receive those requests for rides. So we will want you to articulate your technology and your process here in the proposal for doing so.
Mhm.
And that may come from multiple locations, to Kimberly's point, right? We would to get a patient from A to B. So how will you take requests? Yeah. Three more questions in the queue.
So are we going to get the trips in a portal, or are the trips going to CVS file to be able to be used on a digital platform? So these questions are really kind of operational questions.
Mhm.
And so
Right.
because we're beginning this as a new service, that is something we're going to want to work through with the transportation company that's selected. So I'm not sure if, just make your proposal according to what you can provide to us. And at that time, once that person or that organization is selected, then we're asking to be working through these issues. So I know there's a lot of questions, but we're not the experts with transportation. We expect you to be the experts
Yeah.
in transportation.
I'll back
and to
that,
help
Jackie.
us with
Let
that.
me answer it this way. If
Yeah.
your process is the easiest and clearest, we'll probably pick that. Okay. I don't want to guarantee that, but we are looking for clarity in this. And the more complicated is not probably where we're trying to go. So please tell us how you receive requests, ride requests, these kinds of things, and how you manage it. Jackie, well put. Operations. That's an operations response, right?
Mhm.
So we're looking for the clearest pathway forward here to help our patients get where they need to go.
Panel, I just want to call out this next one real quick. I know we're running short on time, but this person, Tammy, she's just concerned about the 4 to 5 sentence limit that's directed within our RFP, because we didn't put page limits. I just wanted to make sure with you all, I mean, are we open to like longer explanations? I think that's a good question. Are we open to longer explanations than what we have specified in the RFP? I just want to throw that out there as well.
I think they could add it to the appendix.
Yeah, I would. Yeah, thanks, Twing. Yeah, I would
like
go
that.
with, if you have additional process flow documents or those kinds of things that help add clarity to some of this, or an explanation document, I think that's fine. In Twing, you said it, appendix, right?
Yes. Mhm.
Yeah, I think that's the place to put it. We need to move through these proposals, in a relatively efficient way, and that will raise questions. So we'll be able to answer with those additional documents.
I think we're good,
I'm
everyone.
gonna pull up
Go
the timeline
Yep.
now for you, Leif.
It's actually for Jackie.
Oh,
Jackie's
for
the
Jackie.
timeline expert. Yeah.
Yeah, so timeline again for receipt of your application is November 22nd. That's on a Tuesday. We want you to have that submitted by 5 p.m. Central Standard Time, so that is firm. Then we will also be reviewing that RFP between November and December. Once that review is due, we will have that taken to the SSHCO board for approval. And so then those will be announced. The successful applicant will be announced December of this year, 2022. And so just make sure when you upload your information, you attach it to an email and send it to info@southsidehealthycommunity.org. Okay.
With that, thank you, Kimberly. Thank you, Jackie. Twing, Jatan, and Eric, I appreciate your support today. With that, we will put the video up tomorrow in case you need to go back through and ask some of this. You can still send questions in, up until the proposal timeline. We'll be looking at that inbox. So I really appreciate everyone joining us for considering putting a proposal in here to help us in this important project here and on improving health on the south side of Chicago. So thank you everyone for your time. We're going to sign off. I hope everyone has a great holiday. Thanksgiving coming up here. Your proposals will be done before then. So you can go eat turkey, tofu, whatever you do. But appreciate everyone for considering joining us on this. Thank you so much. Have a great day.
Thank you.
Bye.